8 Health Benefits of Coffee.
An analysis of nearly 220 studies on coffee, published in the BMJ in 2017, found that coffee drinkers may enjoy more overall health benefits than people who don't drink coffee. The reason may be the antioxidants in coffee, which reduces inflammation. Inflammation contributes to your type 2 diabetes risk. If you already have type 2 diabetes, however, you should avoid caffeinated products, including coffee. Caffeine has been shown to raise both blood sugar and insulin levels in people with the disease. Consuming caffeine can reduce your risk of developing Parkinson's disease, and research published in 2012 in the Journal of the American Academy of Neurology showed that a daily dose of caffeine equivalent to that found in 2 8-ounce cups of black coffee can help to control the involuntary movements of people who already have the disease. In a 2012 study published in the Journal of Alzheimer's Disease, Florida researchers tested the blood levels of caffeine in older adults with mild cognitive impairments, which can be a precursor to severe dementia, including Alzheimer's disease. When the researchers re-evaluated the subjects 2 to 4 years later, those whose blood levels contained caffeine amounts equivalent to about 3 cups of coffee were far less likely to have progressed to full-blown dementia than those who had consumed little or no caffeine. Several studies published in respected journals have found that coffee drinking has beneficial effects on the liver, including reducing the risk of death from liver cirrhosis, decreasing harmful liver enzyme levels and limiting liver vols, and limiting liver scarring in people who have hepatitis C. In 2013, the journal Epidemiology and Prevention published a review of studies analyzing the correlation between coffee consumption and cardiovascular disease. Data from 36 different studies showed that people who drink 3 to 5 cups of coffee per day had a lower risk of heart disease than those who drink no coffee or more than 5 cups per day. A 2015 study appearing in the Journal of the National Cancer Institute looked at the coffee drinking habits of more than 447,000 people over 10 years. The researchers found that those who drank 4 or more cups of caffeinated coffee each day had a 20% lower risk of developing melanoma than people who drank decaffeinated coffee or no coffee. Your morning coffee could help lower your risk of death. A 2022 study in the Annals of Internal Medicine has shown that moderate consumption of unsweetened and sugar-sweetened coffee was associated with a reduced risk of mortality. The research shows that those who drank 1.5 to 3.5 cups of coffee per day, including with sugar, had a 30% less lower risk of death from any cause during the study. Keep in mind that the research focuses on the benefits of black coffee, which we're still learning about, Rothschild says, but we definitely know the harms associated with the fat and sugar you find in a lot of coffee drinks.